Hi class, this is section 2. This is going to be a brief overview of urinary tract infections. This is where I want you to start taking that anatomy that you've been learning about the renal system and start looking at what can go wrong with the urinary system. And one of the most common things that can go wrong with the urinary system is urinary tract infections. So let's get started. If there's a urinary tract infection, it's caused by bacteria. Bacteria can travel from the outside world into the urethra, into the ureters, to the bladder. It also can go into the kidneys. So if it's cystitis, that's going to be an infection in the lower part. That's going to be bladder, urethra. And if it's pyelonephritis, then that's an infection of the kidneys that's much worse. It's had more time to travel up the ureter, get into the kidneys, and cause a good bit of inflammation. And we see pyelonephritis commonly in pregnant women, and that's because the big uterus that has the fetus in it presses on the ureters and causes urine sometimes to backflow into the kidneys, and bacteria can continue to grow and not be filtered out. Like, it's not going to flow well, so that's going to cause some issues. The most common causative organism for urinary tract infections is E. coli. So how can we know what's going on with the kidneys? Well, one test we can do is a urinalysis. There are different ways to test urine for different things. And so let's talk about those. Normally, the urine is clear. It's got a yellow tinge that comes from the bile that's excreted. But when you look at the picture below that, you can obviously see this is not clear. You cannot see through it. So that one looks like there's a lot of pus or something an infection is going on there. If it's cloudy, it could indicate that there's white blood cells or bacteria, pus, something that's keeping it cloudy. If it's a dark color, it could indicate that there's an excessive bilirubin, or that could be blood. If it has an unpleasant odor, that certainly could indicate some type of infectious process going on. Urinary casts are interesting in the fact that when they are looked at under the microscope, they let us know, like, what area in the tubules does the infection present itself. And so you can take a look at this. You do not have to know this, but it's good to know that the different tubular shaped bacteria or white blood cells or whatever it is that's being seen can let us know what possibly is going on with this person. So we also are going to look at the specific gravity of the urine. So if the urine is really pale yellow and clear, you can literally see through it, that's a low specific gravity. If the more cloudy it becomes, the more that it has white blood cells, or more concentrated it is because the person's dehydrated, they don't have a good urine output, or they have kidney failure, the specific gravity is going to increase. It's not that nice yellow, pale, see-through urine that a normal person should have. And glucose and ketones also have to be seen with the dipstick, and that could also indicate other disease processes such as diabetes or dehydration. There are different abnormalities that the person could be experiencing that would indicate that this is a symptom of that. And so why is that the most common? Well, E. coli is found in feces. So in women, it's more common because the urethra is short, and it's the proximity of that urethra to the anus. So we don't see urinary tract infections nearly as much in men because their urethra is further away from the anus. So in older men that had the prostatic hypertrophy, it's kind of like I was mentioning the pregnant uterus. That prostate gets enlarged and presses on the urethra and can cause retention of fluid and can cause urinary tract infections. And there's other reasons why bacteria can grow in the urinary tract, is that because of a retention of the urine, we talked about that, and incontinence, and direct contamination with fecal matter. We touched on pyelonephritis, and so I just wanted you to see this picture where the urine is backed up into the kidneys, where the bacteria begins to grow in there, and the kidney gets inflamed. This can be serious. It can cause long-term kidney damage, so it needs to be repaired. Sometimes pyelonephritis requires a hospitalization and IV antibiotics. We don't want this bacteria and these infections to get all the way to the kidneys. We want to get them taken care of ahead of time, but most importantly, prevention. We want to try to prevent getting urinary tract infections, treating prostatitis when there's an inflamed prostate, using the bathroom frequently during pregnancy, drinking 8 full glasses of water a day in addition to what we drink during our regular meals, to keep everything flowing and flowing outward. We want everything coming out and not being retained in.